So when we're talking about side effects of treatment, they're different for localized than they are for metastatic. Most of the metastatic cancer stuff is related to the treatment themselves. The chemotherapies can have very different types of side effects, but there are some common ones for those. So um, from metastatic cancer and doing chemotherapy, people always think about hair loss and weight loss, and kind of looking weak. Um, the good news is that the hormone based therapies tend to not do that, but they do suppress male energy, male sex drive, and erections. And so men do really concern themselves with that part of it, but they tend to be functional for working, for supporting for their families, for living. Then there are the side effects associated with the taxanes, like docetaxel, cabazitaxel, that are used for advanced prostate cancer also, that have people having rashes or nerve pain in their fingers and feet, and hands and feet. There are lots of different types of side effects, like that over time affect kind of your bone marrow's ability to make platelets and red blood cells, and anemia can happen in radiation when it gets to advanced stages. And that's one of the side effects of the lutetium-based PSMA treatments is the marrow toxicity suppresses making platelets, which makes it so that you don't have a way to stop bleeding. And so it makes it dangerous, and you have to stop oftentimes because of that. In the localized space, people tend to worry about kind of the things that are going on in the pelvic floor. In the pelvis, the prostate is underneath the bladder, and it's above the urethra. And so men urinate from their bladder through the prostate and out the urethra. And then semen also flows from the seminal vesicles that are plugged into the back of the prostate and squeeze during ejaculation to put semen into the prostate along with prostate fluid and sperm from the testicles to eject out semen that has sperm in it from the testicles, semen from the seminal vesicles, and prostate fluid with sugar water, and something called PSA, which we know is a test for prostate cancer, but is used to make the semen watery so that it can fertilize an egg. Because the creamy fluid doesn't really move well to swim to an egg. So PSA is actually, I call it meat tenderizer. It's a protease that breaks down protein bonds in semen. And so the side effects related to that, those local treatments for prostate cancer tend to disrupt either the nerves for erection that run alongside of the prostate. So erectile dysfunction is probably the one that men worry about the most, but ejaculatory dysfunction where semen doesn't come out the way it used to because you either remove the prostate surgically or because you do damage to nerves with radiation or dry up the glands, and so they don't produce as much fluid. So ejaculatory dysfunction, erectile dysfunction are common after local prostate cancer treatment. And because the prostate acts as a dam for urine flow for men, it can make men either leak urine from having too little resistance when they cough or sneeze or get up or lift things. That's called stress urinary incontinence. And then if radiation does damage to the bladder, it can cause urgent incontinence where the bladder feels like it's empty with very little amounts of urine, and it squeezes and causes a urgent leak of urine where you sort of have to go to the bathroom emergently and you leak urine that way. And then the other things are you get some bowel injuries from radiation. And that's pretty unique to radiation, but it can cause bleeding or diarrhea or the sensation that you have to go to the bathroom all the time for a bowel movement called tenesmus. So there are some rectal bleeding associated with radiation. There are focal therapies that have less of these side effects. It can be laser or freezing, called cryotherapy, or high intensity focal ultrasound. There are a lot of different energies used to kill tumors that you can now see with PSMA PET scans and prostate MRIs. And focally, because you're only treating a part of the prostate, you tend to have less of those side effects. And so people are trying to use those in appropriate cases.